As the old saying goes, what is life? It depends on the liver. Situated below the diaphragm, majorly in the right hypochondriac region of the abdomen, this reddish-brown, wedge-shaped organ is crucial to life. So what does the liver do? The many functions of the liver include detoxification of drugs and toxins, conjugation of bilirubin for its easy excretion, regulation of hormones like estrogen, testosterone, and insulin, production of bile for emulsification, absorption, and digestion of fats, storage of vitamins, minerals, and other nutrients and their release into the bloodstream as required, synthesis of blood proteins like albumin and clotting factors. The liver starts and ends with bile ducts. If bile ducts are the pipes of the liver, the bile duct cells are the metal atoms of the pipes. The cholangiocytes or biliary epithelial cells are specialized epithelial cells that line the bile ducts in the liver. Cholangiocytes are involved in secretion, modification, and transport of bile, undergo cellular proliferation in response to damage or dysfunction to regenerate the damaged tissue. They also produce and release growth factors and cytokines that promote liver regeneration. They interact with immune and hepatic stellate cells to modulate the regenerative response. The functions being so numerous and so vital, the functionality lost in case of damage is monumental. Damage or dysfunction to cholangiocytes can lead to biliary tract diseases called cholangiopathies like sclerosing cholangitis, biliary atresia, cholangiocarcinoma, etc. In case of irreparable damage, liver transplants are the last modality of treatment. However, liver transplants are major surgical procedures and carry significant risks like rejection by the recipient's immune system and infections. Moreover, the demand for liver transplants far outweighs the donor availability, a major cause being a severe shortage of organ donors. According to NATO data, in India, there are more than 20,000 patients on the waiting list for liver transplants, but only about 2,000 liver transplants are performed each year. Many livers are unsuitable for transplant due to a number of reasons, such as the organ damage while in cold storage outside the body. Nevertheless, liver transplants are necessary, life-saving procedures and remain the only viable treatment in many cases. Researchers are exploring alternative methods. A potential therapeutic approach for promoting liver regeneration is replacing damaged or lost cholangiocytes, is cholangiocyte replacement or grafting. This technique was used by researchers supported by the NIHR Cambridge Biomedical Research Centre. They have grown bile duct organoids, often referred to as mini organs or mini bile ducts, in their lab. They have shown that these can be engrafted to repair damaged donor livers. This will increase the number of livers that are considered suitable for transplantation and also potentially help treat patients with liver damage. The research team used a technique known as single-cell RNA sequencing to learn more about the individual cells lining the biliary tree. They found that although duct cells differ, biliary cells from the gallbladder, which are usually spared from bile duct diseases, could be converted into the cells of the bile ducts and replace and repair the damaged ones. They grew cholangiocytes from the gallbladder in their lab using the organoid technology. The organoid technology is small groups of cells that mimic the organ's function. They then took livers from deceased donors. The livers could be maintained for more than 100 hours with the ex vivo normothermic perfusion technique. The cholangiocyte organoids were then transplanted into the intrahepatic ducts of these damaged donor livers. They demonstrated that the transplanted organoids engrafted and repaired the bile ducts, allowing the liver to function correctly. This research provides proof of principle that cholangiocytes organoids can be used to repair human biliary epithelium. Although it has not yet been applied to humans, organoid technology holds great promise for regenerative medicine. The development of new cell-based therapies and this approach could be applied to a range of organs and diseases. What is the future of this finding? Being able to sustain organs outside the body for longer? Modifying organs and tissues to a greater degree before transplanting them? or maybe even creating organs completely from scratch, ex vivo, before transplantation.